Hey y'all, it's Dr. Tiffany. I hope you're doing well. So I wanted to bring you a little bit of science this morning. There was a report published by the American College of Cardiology, Cardiovascular and Women's Committee, which was published Tuesday in the peer-reviewed journal Circulation, that I thought contained some pretty interesting suggestions. So for quite some time now, a lot of doctors have been reluctant to give out hormone replacement therapy for women that are experiencing postmenopausal symptoms or menopausal symptoms. And for a mixed bag of reasons. However, some of them fall under the category of medical bias because there's doctors that believe that menopausal symptoms aren't serious, which is, to me, utter BS, and it's part of the the gaslighting that occurs in medical scenarios. But also there was a large study in 2013 that followed 27,000 women for 10 years of their life that showed an increase in strokes and cardiovascular events. That is what led to that. However, there was a serious flaw with that study, even though the numbers were huge, and that was that the average age was 63. This report actually suggests to be broken down into three categories for informed consent for hormone replacement, which is a model that I like to use in my practice, which is where you give the risks and benefits and the patient decides, which is the way things are supposed to be. Low risk is anyone under 60 and or within 10 years of menopause, normal weight, normal blood pressure, physically active, and low risk for breast cancer. Moderate risk would be diabetes, smoking, hypertension, obesity, elevated cholesterol, sedentary lifestyle or mobility challenged, autoimmune disease, and high breast cancer risk. Now, high risk, the most dangerous category, would be congenital coronary artery disease, people with a history of having a heart attack, stroke, or mini stroke, or a blood clot in their legs, or a pulmonary embolism, blood clot in the lungs. People who have active breast cancer or a history of it, and people with known coronary artery disease and peripheral arterial disease. What that means is that your doctor would tell you what category you fit into and your relative risks, and you make the decision, which is, to me, the way medicine should be. So it takes away the paternalism too. Just wanted to bring you some science. Love you. Stay safe.